Well, Dr. Martin, when people lose teeth, be it, of course, as more teeth they lose, as more the example I'm going to make now will probably be coming up. But if people lose teeth, a bunch of them, 3, 4, 5, and whatever, apparently once a tooth is lost, the bones where the tooth is in it, the arch starts shrinking. Is that true?
That's true, because your teeth, more than likely, well, actually, sometimes. Because sometimes what happens is that when you lose teeth, and especially in the back, you don't have the support of your bite. And as time goes on, if those anterior teeth give way, a lot of times what they'll do is they'll flare. And so you end up really having a wider arch, and you may end up on the lower having a smaller arch. But it really depends on the circumstances of what's being lost. But in any case, you know that your arch form actually becomes less ideal, and that is potentially your bite ends up closing in. You have like that mush bite when you bite together. And under those circumstances, either you do something to correct the alignment of your teeth, or you end up removing them, or you just go with that as things just deteriorate.
Right. So when a person loses a lots of teeth and he's faced between a bunch of implants, which obviously are not always, they're expensive. They can be, it adds up. And within dentures, obviously a denture is a lot more economical. And dentures are good these days. They look good, but they do not replace with that that metal stick into the tooth, and thus the arches can keep shrinking and or deforming, whatever it might be. The bones might be shrinking, and because of it, you see people with that caved-in smile. They look like a dried-out tomato. Basically, they look ugly. Is there something to that when you have dentures with no implants in it, that will happen, and you add years to your life by doing so? In terms of look.
Yeah, with dentures, I mean, basically, when you first have them done, you can open your bite up. But the problem with dentures is that the tissue under the denture, your bone or the ridge, it will deteriorate quicker. So you'll end up losing the support that you need under the denture. And over time, you'll end up having to add more denture material to make up for all the loss of the bone support under your denture. Denture is really the last choice if you can help it. Basically, what that can do is help you make the transition to implants if that's necessary. But ideally, you don't want to do dentures if you can help it.
So basically, what you say is if, for instance, you don't have the finances to do implants, then you might want to go with a denture, but then you immediately go on a rampage of a set-aside plan, and a layaway plan, and you start saving up the money so that a year or two later you can replace it with an implant before you get one of those old, we've seen, most of our grandparents looked that way because there was no implants around and they had to get dentures, right?
Correct. That's correct. That's true. Yeah, with dentures, that is really meant to be a transitional appliance these days. I mean, for sure, our grandparents, they use that as the last as their last set of teeth. Right. But dentistry is providing much more than that now, and you can get so much closer to the natural function of your natural teeth. So once you know that you can function better than you do with dentures without any type of support with them, then you more than likely you'll make an effort to go for the implants or some type of implant support under the dentures.
Right. And again, Dr. Martin, what I try to point out here is yes, the functionability of biting correct and all that, and if you do that, then you don't get the headache. But probably the denture can fix that also, that you guys can put them in correctly so that then you're fine there. Just like with the periodontal, when you get periodontal disease, it's not so much the losing teeth, which is bad, but it's the poison in your body. And here again, who the heck wants to look uglier? Who the heck wants to look 15, 10, 5 for that much, 20 years, whatever it may be, older than he looks? We don't mind looking a little the way, if we're 50, we look 50. We don't mind so much. We love to look 40, but we don't mind the 50. But what we don't want to do is look 60, right? And
correct.
A guy or a girl, it doesn't really matter. We are living in a relatively vain society. Do you know what I mean? We everything is shiny. We do lots of things to make ourselves looking good. So, if people know that a denture, or for that much, several losing teeth in the back not getting fixed, can do the same thing. They can shrink your bones, and by doing so, your mouth gets distorted. And a distorted face is a distorted face. It looks older. End of discussion. So basically, you guys are beauticians. You guys are plastic surgeons.
That's true. I get some of my greatest satisfaction out of being able to provide a smile for individuals. That's really rewarding. I'm
sure it is. After all, a $1 million smile, and in the end, and frankly, we got, I don't know whether we ever got away from it, because we know that a smile is a smile is a smile. A waitress smiling, you immediately dip her a cup a little more. No, she doesn't have to be Miss Universe. She just has to be smiling, right? And
right.
And people with good teeth like to smile, and people who don't, they don't. I remember I had like a brown tooth here some, 12, 14, 15 years ago, and you know what? I didn't fix it for about a year, kind of, you're married, and the truth is, I started noticing that I withheld my smile, and I don't have a very open smile in the first place, but I just didn't do it anymore. And I noticed, when I really noticed it? When I fixed it. That all of a sudden I would be again, kind of go, hey, it's great. But before I would, hey, this is great. So, looking good. And I think as the economy gets, obviously is going through difficult time now, and we might or might not be through that. That's up for a total different topic. It's just like you need every advantage and every little self-confidence to look good, to be good, and to be able to be a people person, and helping people, helping people to smile. It must be a great thing. I really do believe, that's superb. Well, Dr. Martin, thanks a lot.